If you're missing one, several, or all of your teeth, you've probably thought about dental implants, but you might also be a bit scared or think it's painful. Hi, I'm Dr. Tomás García, a specialist in oral implantology, and today I'm going to talk to you about how technology and modern surgical techniques have improved implant placement. A dental implant is a titanium prosthesis that replaces the function of a natural tooth root that you've lost. These are placed in the bone beneath the gum. Later, we make either a crown, a bridge, or a prosthesis, which is screwed onto these implants to restore both your chewing function and aesthetics. All of this is custom made. The result, you can go back to eating your normal diet, smiling with confidence. You no longer need to use those uncomfortable dentures that move when you talk or chew. I know getting implants can be a bit scary, but thanks to technology, today in our clinic, we can perform studies like CT scans or intraoral scans, which allow us to plan these dental implants, making their placement much faster, more precise, and above all, painless. Does getting a dental implant hurt? No. Dental implants are placed under local anesthesia, or if the patient prefers, under sedation. However, thanks to technology, implants can now be placed in a minimally invasive way, which makes the procedure painless, or results in very mild to no discomfort afterwards. How long does the whole process take? Well, that varies. If it's a single implant, placement can take about 15 to 20 minutes. If it's a post-extraction implant, it can take from 30 minutes to an hour. If it's a complex case, a full arch or an all-on-4 or all-on-6 technique, it can take from 2 to 3 hours. Now, once the implants have Osion integrated, it normally takes the body between 4 to 6 months max for the implant to integrate. How long does a dental implant last? Well, dental implants are designed to be permanent. However, it depends on many factors, such as the patient's hygiene and keeping up with regular dental cleanings. But there are cases where they've lasted up to 20, 30, or 40 years in perfect condition. Can my body reject the implant? Titanium is a highly biocompatible metal, so allergic rejection is very rare. We're talking about less than 1% of the global population who experience it. However, what can happen is a lack of osseointegration. And this tends to happen when patients are smokers, have poor hygiene, infections, active periodontal disease, or systemic diseases of their own, or they take certain medications like bisphosphonates. Am I a candidate if I have bone loss? The answer is yes. Nowadays, thanks to advanced surgical techniques in guided bone regeneration, once it's done, 6 to 8 months later, you can be a candidate for implant placement. What is the All-on-4 or All-on-6 system? It's an oral surgical technique that consists of placing 4 or 6 implants per arch, either maxilla or mandible, in patients who have lost all their teeth or have teeth in very poor condition and are going to lose them, what we call terminal dentition. Once placed, these implants allow us to attach a full denture screwed directly to them. What's the difference between an implant and a traditional full denture? Well, a full denture is a removable prosthesis, which can sometimes slip or move around, since it just sits on the gums. That's why some patients, when speaking or chewing, don't feel it's very natural, or rather, it feels uncomfortable because it moves. Implants, however, are anchored to the bone beneath the gums. which then allows for a prosthesis, which lets you, as a patient, regain a natural look, function, and aesthetics. What care does a dental implant require? Well, it's the same as a natural tooth, meaning brushing 3 times a day, flossing, using an oral irrigator or a water pick. It's also important to go to regular appointments every 6 months with your dentist for a cleaning or evaluation. Why are dental implants considered an expensive treatment? Well, dental implants are a specialized treatment. Plus, they're a treatment that allows the patient to regain aesthetic function and naturalness just like a natural tooth. Therefore, they have greater benefits compared to a removable prosthesis or a fixed prosthesis like a bridge. It might cost more in the short term. However, in the medium and long term, dental implants give you better success, durability, and comfort. Well, thank you very much for your time, and if you have any questions, please feel free to leave us a message or contact the clinic at Let's Smile Dentistry and we'll gladly help you. We hope to see you soon.